Hi, everybody. Thank you for joining so far. We're going to give it a few more minutes for some other people to come. Hi, everybody. Thank you for joining so far. We're going to give it a few more minutes for some other people. All right, so we're going to go ahead and get started, everybody. Hi, everyone. Thank you for tuning in to our virtual panel on improving access and outcomes for all with telehealth. First, we will explore the rapid and massive transformation that is happening in the wake of COVID-19. Second, we will uncover emerging technologies revolutionizing how virtual care is delivered. Lastly, we will forecast the future of telehealth and its lasting impact in our post-pandemic world. As we move through this panel, please submit your questions in the comments section. Joining me today is Art Robbins, Jay Televia, and Ryan Mueller. Art Robbins specializes in helping clients from Fortune 100 to entrepreneurs develop and implement their growth strategies. He founded EMCEE, is the America's Director for TwinBit, and has formerly worked at Frost & Sullivan. Jay Televia is the co-founder and CEO of CareNeva. CareNeva's mission is to provide easy, affordable, and quality access to healthcare when you need it the most through their innovative telehealth platform. Ryan Mueller is a telehealth evangelist who works with companies to create transformational solutions. He's a friend of Technossus and was previously a senior consultant at Deloitte and HM Healthcare Solutions. Thank you for joining us today, guys. The world has changed so much in the past few months as we respond to COVID-19, especially in healthcare. What are you guys seeing today, and where do you guys see this going as we pivot to this new normal?
Yeah, certainly we have seen a lot of changes in telehealth as an industry, and specifically, it actually created exposing the industry and their usage. So, last year when we were looking into some of the growth numbers, the growth rate was 25% year over year projected, and last because of a pandemic, we see now the growth rate as revised, and it's a 50% year over year. What it means is that what we were anticipating, the growth of telehealth in 10 years is now it's accelerated to the 5 years. We are also seeing a lot of telehealth visits happening. March itself has increased by 50%. And it is expected that we probably, as an industry, as a whole, we will be completing 1 billion telehealth visits by end of the year. So I think it's amazing how it's actually accelerated in a very short period of time. Of course, one of the other things that we see is the government involvement and their actually support in flourishing the telehealth the industry itself by providing the funding, by providing there is appropriation bills from the governments to actually encourage the practices and hospitals to implement the telehealth.
That's awesome. Ryan, what are your thoughts on that?
Yeah, so John, I just want to thank you for moderating today and Technossus for hosting this. And just want to do a quick shout out to everyone. Hope you guys are staying safe and sane throughout these crazy times. I think is what I'm seeing, John, is from a provider perspective, healthcare providers are now starting to see that they need to integrate with many different telehealth vendors. I think in the past it was really underutilized, and each kind of healthcare system maybe had that one or two key vendors or core relationships for certain specialties that they were utilizing telehealth for, and that's just not the reality anymore. The future is bright, and I just want to say how glad I am that we're talking about this. I'll quickly touch on some of the work that Technossus has done in this realm. We actually built the APIs that allowed for the integration with previously Dignity Health, now known as Common Spirit, due to the merger with CCI. So it's pretty cool work that's now paying a ton of dividends for patients. So, good timing on Technossus's part. And, it's amazing now to be able to actually see those interactions occur based on work that we did. So happy to, be a part of that. And then I would just say more in general terms in the future of telehealth. I think it's really exciting because I'm passionate about the cost of healthcare and the accessibility to healthcare. I think over time, it's going to drive down costs, it's going to increase quality, and it's going to make it more accessible to people that, may not, have a car or even that transportation, to be able to drive where they want it. So exciting times. And it's a great topic to be discussing.
That's great. Art, do you have any insights on that?
No, thank you, John. And also I'd like to thank Technossus for hosting, and hope everyone's staying well and channeling their restlessness to constructive endeavors. Just like Jay and Ryan, I mean, we see tremendous opportunities with telehealth. And I think when you talk about telehealth, you should also think about the different segments of the market. There's basically three major areas. You have the data capture and storage segment, which basically handles electronic records processing and image processing. Then you have the self-monitoring segment, where patients are generating data through wearables or through Internet of Things devices, getting it asynchronously to their providers. And then the third is you have the real-time telemedicine, where you have the video and phone consultations, where the doctor is, observing, diagnosing, and prescribing medication without an office or hospital visit. And a lot of the activity since COVID has really been around the astronomical increase of the latter, of the real-time telemedicine segment. And we've seen huge spikes in telemedicine visits, over 50% increases in the month of March. If you talk to individual entities like Massachusetts General, they've had a 100-fold increase in virtual visits, from 2,000 a month last year to over 250,000 a month just last month. In China, Ping An Good Doctor had 10 times the number of consultations online. So these numbers, are huge, and they've definitely put the telehealth segment on a totally different growth trajectory. And I think the government does deserve some credit for facilitating things, for relaxing HIPAA requirements, because FaceTime, Skype, these are not approved HIPAA platforms. I think so some of the questions, which I imagine we'll address later, is how sustainable is some of this growth? Will some of the steps we took to open up, the telemedicine virtual visits, are they going to be long lasting, or will there be a retrenchment, going back to the way it was?
Well, that's a really interesting point, Art. In your guys' experience, how are healthcare and provider companies kind of dealing with this rapid increased usage in such a short amount of time? From my understanding, healthcare is kind of a slow-moving industry because it's so regulated, but obviously with COVID, we had to make changes so rapidly.
Yeah, and I think this is actually true for all industries that regardless of the industry, traditionally companies have been very slow to embrace digital transformation. They've been more comfortable kind of dipping their toe in the water, phasing things over time, piloting small initiatives, and I think one of the lessons we're learning, and this is a cross industry point now, is you can't afford to do that anymore. You have to embrace digital transformation wholeheartedly and more rapidly. And you have to be more agile and resilient in your business. Um, and I think that the companies that are finding that they're not agile enough, they're falling behind. The ones who are resilient, that can adopt a big digital transformation initiative, those are the ones that are coming out ahead here, because they're able to shift their business models much quicker. They can go from in person to virtual. They could shift a supply chain. They could shift a workflow, and it's a totally different mindset than what we've been trained on for so many years.
Yeah.
Yeah, I
Jay,
think,
how are you seeing your clients kind of deal with that?
yeah, definitely. One of the trend we see it, as compared to last year is the buy-in process, right? The COVID-19 actually created an environment where you don't really need a buy-in from patient or the providers to be able to implement the change that is necessary. And so I think that's one thing came out very nice for the telehealth industry itself. But the most important thing, like one of the Dart mentioned, is the changes, the laws that actually that change, or they had to relax some of the rules. That kind of indicates that the innovation has outpaced the laws, right? And what the future look like beyond the COVID-19 is that the directionally, some of the laws will be reformed to flourish the telehealth industry itself. So telehealth is here to stay and is continuing to grow. I think all the practices and medical groups, they really need to think where they can leverage. There is no one size fits all. So I think every businesses, they need to think where they can leverage, where is kind of important in their workflow, and how they can make the efficient process. That's kind of a very critical component for practices to kind of look into.
Definitely. Well, so what were kind of some of the biggest challenges that you saw from those organizations that weren't necessarily digitally prepared, to kind of transform in such a short amount of time?
Definitely, I think it's kind of off guard for if you look at the March numbers, right? 97% of the practices reported the negative growth, right? So and that's just so mind blowing, right? That shows that how unprepared we are in order to deliver the care in a different media. And I think this is a good learning for the businesses, the practices, and medical groups to see there's not only one medium to deliver the care. Now they have to adopt different mediums where they can serve the patients and the vice versa.
Definitely. And in terms of healthcare transitioning, are there other industries that have implemented similar platforms or anything that healthcare can kind of learn from in this time?
Yeah. Well, we've seen a lot of industrial segments adopt remote monitoring. We've seen that in the manufacturing industry. We've seen in the oil and gas industry, petrochemical industry. I mean, it's really interesting. Like, if you take oil and gas, obviously you're talking about very hazardous, harsh environments, and people might need to expect pipelines or oil well performance, and it's not easy to get to. It's also hazardous to be there. So, to have Internet of Things, sensors and monitoring devices that can, track anomalies and then report it to a control center. And now, the control center can, either shut down a unit, or it could reroute, product flow. Many of this could be done automatically without any human intervention. So, there's parallels to healthcare with the same concept of, constantly monitoring a patient and, notifying a medical practitioner if there's an anomaly that maybe the patient's not aware of, but either a artificial intelligence system can detect, or the practitioner would detect, and then be very proactive in notifying the patient and treating the patient. So
Yeah.
I agree. There are definitely lessons to be learned from other industries.
Yeah. And Ryan, even with this increased agility that Art just mentioned, what benefit do you see that have with those industries or companies you've worked with, just having that increased agility and access for patients and providers?
Yeah, it's huge. I mean, that's the critical component behind it. A lot of these healthcare companies, they don't know where to start with digital transformation. I mean, I know we've seen a little bit of a slowdown in healthcare, but even then, there's more work to be done. Providers and the executives just don't have the bandwidth to do it right now. So it's an interesting problem that they're trying to navigate. And I think, you guys hit it spot on. You need to be agile. You need to continue to be innovative and bring in new digital technologies, which I think we'll talk about in a minute. But yeah, I think it's an interesting place to be right now. I think this entire COVID-19 issue has been it's a disaster, but it's also been a wake-up call for the healthcare industry to be more agile and flexible, and provide more care to people who truly need it in a more efficient way. That's what we're all going for. So yeah, it's a sad, but it's an exciting time.
Yeah. So, with that, do you think COVID kind of accelerated change that was already happening, or do you feel that it uncovered new challenges and solutions that the healthcare industry kind of wasn't seeing?
I think it's probably a little bit of both. Oh, was that for me? Sorry.
Oh yeah, that was for you.
Okay, yeah. I mean, I think it probably goes out. It's a situation where change was coming and people have that vision and they talk about digital transformation, but I think this was the big accelerator. So I think now you actually see real change, and that's exciting.
I would say the thing that COVID really uncovered here was the scale issue. I mean, these changes were in the works in some form or another, but I don't think anyone anticipated having to scale up, to address this type of pervasive problem at the pace and the magnitude that it requires. And when you talk about anything digital, scale provides a whole new set of implementation challenges when you have to implement a system this large, and that's going to effectively tackle the challenge.
Definitely.
Yeah, I have seen the similar thing. Talking to a lot of hospital and medical groups and practices. As Ryan mentioned, it's accelerated. What they have mentioned in their roadmap. The telehealth implementation was like in 2024, 25, right? And now everyone's kind of jump into it and make it a high priority. to do it this year, right? So I think it's definitely kind of accelerated in many cases, bringing those the roadmap, and changing those to kind of implement the telehealth capabilities.
Yeah. So, my question, I guess, is, what new technology or innovations are you guys seeing out there that are really changing the telehealth game and making it so much more efficient that it can be scaled a little easier?
Yeah, so, this is like the telehealth is actually, transforming the how the care is delivered and how it's going to be delivered in the entire health industry. We have seen a lot of the AI products rising up, that will both, helping to make a decision or helping to provide the information to the providers to make a decision. And it's now it's going beyond the basic functions of, reading the pulse and some of those X-rays and MRI to actually becoming intelligent. I think Art mentioned some of those. The AI related is that, patient would not know whether they are going to get sick or they are sick, but the monitoring and sensors will monitor to kind of alert providers that there is a possibility of heart failure, for example, or there are some of those symptoms that they can see early stage. That kind of help diagnose in a 2 weeks early than it's expected. So there are a lot of the AI products. And one thing that is important is that it is important to know which of those technologies can fit into your practice or fit into your care, uh, that that you can implement, right? So, for example, there's a also chatbot, coming into picture where they actually help diagnose it. It is good for certain kind of functions, but then you need other technologies to kind of diagnose on more complicated stuff. So I think we have seen a rise in AI products, definitely, in kind of in the telehealth space. Of course, there are devices actually coming as well, where do it yourself, right? You buy it at home and continue to monitor, and that gets synced into the cloud that ultimately you can share to your doctors as well to monitor. So I think what we are seeing is more growth into the remote monitoring, and the tool and the technology behind it, data-driven models that will definitely help create the insight for the providers and the patients to monitor their health. So I think there is exciting actually development and research going on, and a lot of products will come out in a very short period of time as well.
I'd like to add, I agree with Jay's assessment of the types of technologies that are hot and are going to add a lot of value. But I'd also like everyone to think not just about the technology itself, but also about innovation of the business model. That's one of the things we see when we're helping companies with digital transformation. Is that, don't just think about the technology, think about your overall business model and how you're going to enable that technology to improve the customer experience and have better quality and a better outcome. And when I was thinking about this, I actually thought about a great case study I'd like to spend a minute on. And it's a case study that comes from China. And I know that might not be popular these days, is to talk about a Chinese case study as a best practice, but there really are things we can learn from other countries. And you might have heard of Ping An, which is one of the largest insurance companies in China, and they recently, a few years ago, rolled out an online health services platform called Ping An Good Doctor. And this is truly an amazing platform in terms of the adoption rate and the level of usage and the level of value that it gives to the client. If you look at many of the technologies and vendors that are out there today for telehealth, they're basically offering point solutions, very narrow
Yep.
solutions. What Ping An Good Doctor basically does is it actually provides a holistic platform that addresses the total patient experience. I mean, say, from in sickness or in health, from cradle to grave, whatever. It's covering all of that in one integrated platform. It's making sure that every patient, every family has a family doctor. It's making sure that there's a single electronic health record for the entire patient. It's tying the patient to insurance coverage. It's providing a seamless method to get both online consultations as well as offline services when appropriate. And as a result of this, they have over 300 million registered users with very high activity rates. I mean, so in the COVID crisis, they've had billions of consultations on the online platform, and they consciously offered free consultations, related to the coronavirus. So, and they do other things, to support, lifestyle, wellness. They have gamification. So, their whole motivation is to improve the activity and the loyalty and the usage of the platform. And another thing, we talked about AI, the fact that they have so many consultations and the data that's in there. All this data is feeding their AI machine learning platform. So their ability to recognize patterns, and do better diagnostics. They have a much higher accuracy rate than any other AI health platform in their market. So they're delivering a quality experience, holistic experience, and I think there's a lesson for companies here in the U.S. To think about what type of platforms can we develop, to improve healthcare on a much larger scale, improve the quality of results. And some large companies could do it. Others have to form ecosystems, and band some of the small and large companies together. But there is an opportunity here. There's definitely a market here to have such platforms, that deliver these kind of outcomes. And again, it's a way of meshing a new business model and the enabling technologies to achieve those outcomes. So I just wanted to share that as a very interesting example for all of you.
Yeah, I think no, well said, Art. I think I have seen kind of a similar trend. A lot of right now telehealth is a transactional. We have where you talk and you're done, and then you're left alone to figure out what's the next step is, right? And specifically, so what we are focusing on, and our platform, the Care Niva platform, is focused on is all about connected care, where the patients and the doctors, right, they need to be connected online and offline, when there is a need, right? It's not just like you talk and now go figure it out if you need a further care, right? So we believe that the connected care at the local level, it is very critical to delivering in the care that they need. So we're definitely in that sweet spot where we work with the practice and medical groups to allow them, to enable them to provide the telehealth, so that they not only They can care their patients online when they need it, but also if there is a need to reconnect to the same doctors, you have an option to do that. So
Yeah, that's a really good use case, Art. I really liked it. One of the points that stuck out when you were telling it is sort of that data concept. And I think for a lot of the more established providers in the U.S., that's probably not a huge deal because they've probably had these things in place. But for those newer ones just implementing this, I would imagine that lack of data to start at least has some effect on that AI's effectiveness in those telehealth platforms.
Oh, definitely. I mean, the data is the engine, right? So,
Yeah.
but again, I think this is where there's opportunities at an industry level, to form, consortiums, ecosystems where this data can be shared for, the broader good.
Mm-hmm.
So
What are your thoughts on
another
that?
growth opportunity that can emerge from this.
Yeah, Ryan, do you have any thoughts on that?
Yeah, I mean, I think, data, especially big data and analytics, are huge in healthcare. So I think, just kind of going back to your other question around technologies, and we talked about them a little bit, remote patient monitoring, wearables. That's a situation where you can be in the comfort of your home. A provider can access your data in real time almost immediately and then make decisions on it and run different reports and run different analytics that are ultimately going to lead to better outcomes. So I think on the theme of data, like Art brought up, I think it's so critical that we continue in the healthcare industry to make sense of it, so our providers and clinical experts can make better decisions that are going to ultimately lead to increased life expectancy and to save lives. And that is one thing. You hear all these different companies and providers coming up with data governance and data strategies, and a lot of that is around that big data and what can we actually do with it? Where does it reside? How can we actually make use of it in the industry? And just be able to get that from a wearable, from a chatbot, from some other sexy AI emerging tool is pretty cool. And we're going to see so much more of that as the telehealth movement continues to progress.
Yeah, definitely. And Jay, I'd be really interested to hear kind of what services or practices are now available virtually that maybe weren't before, or maybe were considered taboo before COVID hit.
yeah, I think there are so when I was looking yesterday, there's like about 500,000 practices, 500,000,000 practices and firms within the healthcare industries. And it used to be like everyone was focusing on a primary care, which is very critical one. But then now it's opening up of a lot of other area in the healthcare is started to adopting the telehealth itself, right? So and that is an interesting trend which we were not even expecting to penetrate that deep into the healthcare. So that's one thing we're kind of seeing, is that it's not going to be in one area, but it's going to be spread across the industry in adopting the telehealth.
Mm-hmm, definitely. And Art, what that was a great use case, very relevant, obviously. But are you aware of any companies that are in other industries implementing sort of patient or customer platforms that telehealth can learn from and kind of innovate itself with?
Well, I think we should look at best practices around customer experience. Online platforms that really put the customer front and center, and also capture information about the customer to basically feed relevant things to them. So we can all think of some examples. Like Amazon, for example, knows the customer inside and out. But again, that's another platform that's customers very loyal to that. and they continue to innovate and provide more services, to the customers. So the platform becomes part of the user's lifestyle, and I think that's there's actually a higher social benefit if a healthcare platform can do that, if it can really become part of the patient's lifestyle, because that will encourage wellness and better behavior and better monitoring and proactively dealing with issues either before they come up or at an early stage.
Yeah, that's really interesting. I think that really parallels with that sort of remote monitoring technology that's becoming more widely spread. It really extends sort of that reach of the hospital to that person's home, and allows for more preventative care rather than just taking care of the problem once it exists.
Yeah, I think one statistics interesting to kind of look into is, if you look at the other developed countries, right, the Europe, Japan, and other, if you look at their visits to the doctors, number of visits to the doctors for the wellness and continuous guidance getting from the providers versus United States is about like a 4 to 13, right? So some of those countries actually get the guidance 12 to 13 times a year, while in the United States it's about 3 to 4 times, right? And so what indicates, and there are a lot of factors, right? Of course, like easiness, how easy it is to go see your doctor, you gotta take a half a day and off, or you gotta schedule, match up the schedule with your kids, schooling and all other stuff. It's a big hassle for to spend 5 minutes in some cases, right? So definitely I see making it convenient and easy for patients to get the care they need, in a circumstances where they can just talk to the doctors virtually. I think is a big huge win.
Yeah, that's awesome. So, with the immense amount of rapid transformation and all of these innovative technologies that we've just talked about, where do you guys see telehealth in, say, the next 5 years?
Yeah. So, I just wanted to touch on, I think I've been out in the market a lot in the last year, and I've seen a ton of new startups around these technologies and telehealth in general. And I think the amount of entrepreneurs that are going to come out of this is going to be phenomenal. Just as the business models and vendors continue to evolve, whether that's starting a company from scratch or from building a different component or service offering for your company, I think it's really exciting. I think actually too, I think it's going to create a lot of jobs, which is going to be awesome. Not only in IT, but financial, business people, operations people. So I think that's one component of it that we haven't really looked at yet. I think that's going to be exciting, especially when, unfortunately, unemployment is, I think, the highest it's ever been, almost, maybe. I think you hear something different every day. But that's a cool thing that's going to come out of this in time. And I think just to touch on, what I talked about before, from my perspective, it's just, I know that a lot of people have that comfort in going to and seeing the doctor in person and, having that hour-long interaction, maybe 2 hours in the waiting room. It's going to be, an awesome thing moving forward. And again, it's going to make healthcare more accessible to people. And I think it's going to lead to higher quality of care, which is the most important. I mean, if you look at the numbers, unfortunately, doctors have some of the highest suicide rates out there. I'm pretty sure, unfortunately, it might get worse as a result of this, at least in the short term. Doctors are burned out. Doctors are super stressed out. So, if they can maybe save a little time in between appointments and have there be some more efficiency there, I think you're going to see a lot of domino effects and improvements in the industry because of telehealth. So, excited to see where this continues to go from my perspective.
Yeah, I would agree with Ryan. I think the whole impact is going to be a very net positive. I mean, there's no doubt that telehealth is going to be high growth. I think the question is how much high growth. I mean, I suspect that the the growth rate probably would go down some after this year. This year's growth rate is unprecedented. But I think what will keep the growth rate buoyant is the extent that government continues to support telehealth, that these laws we're talking about do get relaxed. So it opens up care and makes the regulations less restrictive. But also there needs to be the quality of outcomes that's delivered. So making the data more accessible, encouraging the formation of these platforms and ecosystems we're talking about, so patients can get higher quality experiences. And then I think there's also infrastructural issues that need to be addressed. Rolling out 5G, will be huge. Making sure that everyone has access to high-speed internet or smartphones. Right now, if you look at society, still about 40% of low-income families do not have access to broadband. And it would be a shame if this turns out into a social divide where there's still the haves and the have-nots, where the people who can afford it, they have access to telehealth. The people that can't don't. And I think that's an opportunity for both business and government to make sure that there is a level of democratization. It doesn't mean we're a socialist country, but the technology is there, so everyone can benefit from these telehealth platforms. But we need to have the infrastructure and the access to support that. And I think if we do those things, we're going to see much higher growth rates than we would otherwise coming out of the pandemic.
Definitely. Jay, what are your thoughts?
Yeah, definitely. I agree with Art on reaching to the people who are currently not able to access to the care. I think it's critical. I think it's totally not acceptable in this day and age that you can't get the care. And there's a lot of rural area, and I was talking to one of the rural area the day is that there is no doctor in 200-mile radius of that town, and it's just not accessible for months, right? And I think those are the areas that the technology telehealth can really help and should make the difference to bring those people in and providing the care. One of the trend definitely, like a lot more and more people are now tech savvy. People have the phones and digital medias in their hand, and I think telehealth is easy to adopt in that space. So we think I think as we progress, as we kind of implement those newer technologies, either comes into play, like we have VR or any other those some of those technologies currently in a gaming side, but it will be adopted into the telehealth fold as well. So I think what we see is not only it's a growth that is happening, but we predict that it's going to be the upside down, meaning that there will be more telehealth visit than actually in office, and that trend is we don't see that far within 10 years that's going to happen for sure.
Yeah, that's super interesting. I think definitely this has brought on a change that will continue in a lot of ways, but I'd also be interested to hear, Jay, which services you think after we return to, the normal, not this new normal, what services will kind of regress back to in person versus that telehealth channel?
So that's a good question, John. I think there's lots of the the rules relaxed right now. Not only for private payers, the Medicare and Medicare, there is no the boundaries now to provide care, right? And directionally, right? If we see it, definitely, the new laws will continue to support telehealth as we go. But then there are some of those rules that is relaxed just for COVID-19 to provide, to enable the providers to deliver care. Maybe those will be kind of come back to us. Like, for example, state boundaries. There are some of the state laws that's specific to the state, and there will be come back to some of those items. But there are also efforts going on to how to get the license, providers to get the license for the other states as well, and there is an effort going on to minimize that overhead. I think there is I used to take like a 3 or 4 months. Now you may be getting in like a 1 week and stuff. So they want to, it's definitely, directionally, telehealth, the new laws will support telehealth. But I do see that it's not going to be as relaxed as what's it is right now with the COVID-19. I think they relax some of the HIPAA rules and stuff like that. I think they will continue to um, come back after the COVID-19 as well. So
Yeah, very interesting. Very interesting. With that point, I think I'd really, like to move into our Q&A session. I think that was a very insightful and informative discussion, RJ and Ryan. And so now for the audience, please submit any questions that you guys have in the comment section, and we'll answer those. As for the panelists, one of our viewers sent me a really interesting point that I don't think we discussed in the innovative technologies section, and that would be VR and holographic technologies in telehealth. They talked about how their 89-year-old parents definitely prefer telehealth versus going into an office. So how do you think technologies like VR and holographic technologies would kind of allow those older segment or older people to not have to come in?
Well, I'll come. I mean, I think it comes down to the quality of the diagnosis and the treatment. I mean, there's certainly a set of things that could be handled remotely, and there are other things that probably can't. So I think the quality of the treatment will speak for itself, and the other factor, frankly, is probably also an insurance factor. I mean, whether it's Medicare or other insurance, to what are they going to allow? So I imagine that we're going to see lobbying efforts as this is playing out to have more and more procedures and codes covered by virtual visits than they currently are, and then over time it'll become acceptable. As Jay said, we'll flip it where we'll have far more virtual visits than in-person visits. But I think we're going to have to probably go through that process in order to get there.
Yeah, I'm sure it'll definitely be a process. Go ahead, Jay.
Yeah, I think some of the technologies that I see it's in an advanced stage is a remote surgeries, right? Be able to do some of those work remotely. Whether a doctor sitting in their office while patient is in an operating room, and be able to see and do this, perform the surgeries. That's already in kind of research in an advanced stage, and we see that coming into fruition in very near future as well.
Wow, that's really impressive. Yeah. So we have another question. So, Jay, I think this is a good question for you. Regarding diagnostic tests enabled by the Internet of Things, what brand or brands and models of device are being considered for communication within the application platform?
Yeah, so we started to see there's a lot of the devices that started to, for example, the companies like ThinkLabs building some of those uh, um, digital devices that actually connects back to the cloud to provide those to the providers. I think the basic stuff you have to understand, like is already in the market and is actually working. If you want to do, let's say, pulse, right? Some of those key components for telehealth is, and I hear over and over with the from the doctors, is that they want not only talk, right, but they want more data to be able to diagnose properly, like they do in office, right? The vitals, how to get that accurate to probably, right? They listen to the heart, right? They used to do, with this murmur, or is there anything that they can catch, right? And I think the part of the next version of telehealth is to be able to provide all those informations in the hands of doctors to be able to make a decision, or at least provide those metrics so that they can make a decision. One of the things that our platform supports and we're doing is that providing that information, initial information, to the doctors. Like, doctors actually now they can see, and we provide them the metrics that they can say, all right, hey, this pulse looks good, abnormal, or maybe there is a abnormality in certain areas, so they can kind of recommend the next steps in the process. And so I think now it's time to go beyond the basic consultation and care to take it to the next level.
Interesting. So another question I had for you guys, so I know there's a lot of fear with, the AI we mentioned before of, physicians' role getting replaced. How do you guys see telehealth innovations like AI impacting the physician's role in a positive or negative way?
I'll take that. I think that's a false prediction, to be honest. I think these AI technologies, even as far as to say robots in the future, they're only going to make the physicians' lives easier. The physicians need to spend time with people that actually need their in-person time. So, there's going to be, there are going to be new virtual nurse assistants, and there's going to be new coordinators within these telehealth vendors that need to be more involved to make sure all this is running smoothly. But I personally, don't see that, which is a good thing, of course. That's my perspective. I think it's only going to enable the quality of care to go up with physicians versus, anything negative. I mean, there may be some of that, but I would think it would be very minimal.
I mean, I would agree with Ryan. I mean, I think that if you look at AI, for example, I mean, one of the things AI is great at is pattern recognition. So if you're looking at radiology images or EKG charts, it might be able to notice an anomaly faster and more effectively than a doctor might. And that would be good for the doctor. And then, as Ryan pointed out, there's still a role for the doctor to interact with the patient and make sure the patient understands the situation, knows what the treatment is, know how he needs to adjust his lifestyle. So I think the best solutions are ones that are going to support a blended, online and offline experience for the patient. And the companies that develop those solutions are going to be the leaders coming out of this.
Mm-hmm.
Yep. I think it's going to be a partnership. I think the doctors, I don't see that the role is replacing, but this role is changing for sure. they will, I think those lower level work that, AI and other technology can do, while doctors probably is going to roll to take it even like a higher level, meaning that, they are not going to be doing the simple stuff. That's probably they can leverage tools and technologies and AI models, but then they go and look at more complex things that is their needs are. So I think they should take it as to their advantage, um, and learn about it, use how they can use it to enhance the care delivery. I think that's the role. I think I see it in moving forward, but definitely it's changing.
Yeah. And, one last thing I wanted to touch on, as we're getting close to the end here. Jay, with a lot of the clients you've been working with recently, with having to change so rapidly to this digital medium versus in person, are there any mistakes that you've seen some companies making, or any considerations that maybe providers listening should take into account as they begin their digital transformation?
Yeah. One thing for sure, in the healthcare industry currently, most of the software, most of the solutions that no one likes. You look at the EHR systems and all those, and I heard a lot of complaints about everything they use. So I think definitely what is needed is that I think they need to work with the companies that cares about their flow, that cares about how they efficiently they deliver their care, and cares about in some cases customizing the solution to fit into their area, because each area, each state, based on the law, there is a different way of delivering the care. So it is very important, I think, is that they are able to deliver the care without worrying about tools and technology, right? They shouldn't be changing their way of doing to fit into the software, but the software should work for them. And I think that's I think very critical as they think about implementing the solutions, telehealth solutions.
Definitely. Art or Ryan, do you guys have any thoughts on that?
No, I would agree with Jay. I think put the patient first, and design the solution, implement the solution to improve the outcome for the patient. To me, that's the winning formula.
Yeah, no, I think it was well said. It'd be nice if there was a one-size-fits-all approach to all these components. But, that's just not reality that we live in, and it's going to be a while. So, yeah, I think it was hit the nail on the head.
Awesome. Well, that's all the time we have today. Thank you again, Art, Jay, and Ryan, for your time. And thank you to our guests for joining us today. I hope this panel has displayed the value and importance of telehealth in our current crisis and how it will be a staple in our post-pandemic world. To learn more, please reach out to me at john.morgan@technossus.com. Have a great day, everyone, and stay safe.
All right. Thank you. Thanks, John. Thanks everyone.